part of the group?
Yes.
Okay. Crying that, oh my God.
Good evening to you all. Oh, sorry, good afternoon. This is Kampala Group. This is Kampala Group's and the course unit public budgeting. And we're looking at Kampala budget cycle in the health sector. This is a quote from David Rhymes. A budget is telling your money where to go instead of wondering where it went. Our case study is about Kampala's budget cycle, Kampala's budget cycle in the health sector. Driving our concept from the public budgeting course unit, we managed to make research at Kampala City Council Authority, KCCA, for more clarified information about the city's health. That's why we went to Kampala City Council to find out more about health, the health sector in Kampala. Literature review, someone will take that.
Good afternoon. I'm Joan. Here I'm going to talk about the literature review. Then, according to the Global Development Consulting Agent based in New York, Kampala is the 13th growing city in the planet. Here why I'm saying the planet, I'm meaning Earth. Kampala practices a multi-party democratic parliamentary system elucidated in 5 divisions. The 5 divisions are Kampala Central, then Rubaga, then Makindi, Nakawa, and Kawempe. And the center, with different health sectors such as Kamombogo Health Center in Kawempe, Chitebi Health Center in Rubaga Division, among others. The health sector in Kampala is managed by the Public Health Commission under KCCA, which is headed by the Director of Health Services and Planning by Dr. Henry Mwebesa.
Good afternoon to you all. I'm talking about the legal framework. Basically, since Kampala City is under the governance of Kampala City Authority, Kampala Capital City Authority, which is KCCA, it has its own constitution. And we basically covered the health sector, and according to the KCCA Act of 2010, the health sector is majorly governed by Article 5 of that constitution, which is here stipulated here down, showing therefore this gives KCCA the audacity to carry on with health matters of the city people. So basically it's an independent constitution, which is the KCCA constitution, and then the Article 5 is one that basically talks about the health sector, which we're talking about next. Shanita, come and talk about the aims.
Good afternoon. The Kampala health sector has aims. The first one is to improve on the public health for the Kampala people. Self-explanatory, right? The next one, to refocus on the priorities towards achieving the sustainable development goals. Okay. Usually, let's say you have aims and you're targeting at something. Usually, you have priorities. For the KCCA, one of their priorities is like focusing on the sustainable development goals. You need examples? I don't think I know. Okay, the next one, to improve access and reduce income inequality, right? Yeah, to improve access and reduce income inequality. Usually, I believe the income inequality comes in when the money is not well catered for or like misused. So this, one of their achievements is to reduce income inequality. Next. Okay. Then the achievements of the Public Health Commission. According to the Health Sector Development Plan, let's see. Clara.
Good afternoon, everyone. My name is Kaganzi, and I'm going to talk about the achievements of the Public Health Commission. Well, while we were at KCCA doing our research, we met a budget liaison personnel called Joel Mwesije. Joel Mwesije told us that there are three commissions at KCCA. But for today, I'll talk about the Public Health Commission because it's what we focused on. So he told us that it works hand in hand with the Health Sector Development Plan. The Health Sector Development Plan works countrywide. So that's how Kampala comes in, and Kampala has our case study well. Its achievements, one of them is that it has managed to eradicate poverty and hunger. How? Today, the Kampala people are able to live less than $1. Let's say $1 today is around 3,550, right? A person in Kampala today is able to live less than that. Before it was around 2,500. Then that means that by that time, before they haven't really completed the poverty, but they have at least tried, right? Then it has also promoted gender inequality. How? Gender inequality is when we don't look at the males over the females. We look at them at the same way, right? So the Health Sector Development Plan, in line with KCCA's health sector, they have managed to promote this gender equality. That's why you see we have prominent women like our own Minister of Health, Dr. Jane Ruth Acheng. We have the current ED of KCCA, Jennifer Musisi, and it also has managed to improve the maternal health by 3/4 between 1990 and 2015, according to the Health Sector Development Plan, in line with KCCA's health sector. We got all this from the budget liaison personnel at KCCA, Joel Mwesije. I'll talk about the challenges too. Well, as we moved on at KCCA, we met a biostatistician. He's called Mr. Chigundu, Paul. Paul told us that there are various challenges that the health sector in Kampala was facing. First and foremost was the low levels of technology. You see, when you go to health centers like Komamboga Health Center in Kawempe, there are low levels of technology. How? They don't have a database whereby they'll record the number of women that have given birth that day. So if this personnel wants more money, they will actually lie and say that there were, like, let me say 13 women who gave birth today, yet there are actually 5. So where are those other funds that are supposed to cater for the people that didn't appear supposed to go? The low levels of technology are becoming a challenge. We have the limited funds. KCCA is not getting the amount of funds that it's supposed to get. At the beginning, while we were there, we asked them why the budget cuts. And they told us that the government is actually not providing enough because of the limited funds. And that's why they're leaving out other works untouched in the health sector. We have the expired drugs on market. You go to health centers still, places like Komamboga Health Center, they have expired drugs that they're giving to the to the citizens of Kampala, and this becomes a threat to our health. We have a limited number of medical personnel. We don't have enough doctors. That's why you see doctors going on strike here in our own city, Kampala, and the next day we're on BBC. How shaming. Then we also have the increasing population growth rate. He told us that the increasing population growth rate of 4.03% is actually a threat. It's the highest in all districts in the country. That growth rate is the highest. So that means that the administrators are supposed to work on that, but we don't have them. We don't have the doctors to cut down the increasing diseases or something like that. I'll move to the next slide. This is the report outlook in different divisions. According to Mr. Chigundu Paul, a biostatistician at KCCA, he was our source. He told us that these are the different divisions. Kampala has 5 divisions. We have the Kampala Central Division. We have the Kawempe Division, Nakawa, Machindye, and Rubaga. Well, we talked about the inadequate data sharing, right? Now, you see here, in the Kampala Central Division, the actual reports that were given in July 2018, by the time we went to KCCA, were 92 reports. The expected reports were 93. Where is the other report? Then that means that they're going to budget for the 93, and the 93rd report will remain missing. We are in Kawempe. The actual reports that were received in July 2018 were 86. The expected number of reports were 87. They're going to budget for the 86. And the 87th report in Kawempe Division won't be budgeted for. Same applies to Nakawa. 136 reports were handed in. 140 were expected. That means that it's going to affect the budgeting for these people. They're going to actually budget for the 136, and where are the other 4, right? The other 4 budgets. Much in the same applies. Rubaga, same story. So this inadequate data sharing, right from the low management to the top management personnel, the Dr. Henry Mwebasa, the ED, the current ED of KCCA, they're not getting the information they're supposed to get for the people of Kampala. The next slide. Someone else will talk about the current projects in Kampala.
Good afternoon, members. I'm going to talk about the current projects. And the first one, 3 million project for improving sanitation in Kampala schools by Bill Gates and Melinda. Then the second one is tobacco-free campaign. The third one, school sanitation funded water aid. The last one, improved sanitation funded by Great. The conclusion, someone else.
Good afternoon. I'm going to elaborate more on the current projects. So in our slides, we mixed the current projects with the sources of funds. And we got this information from the KCCA, from the person we asked. So the first is 3 billion projects for improving, 3 billion projects for improving the sanitation in Kampala schools. So most sanitation programs and projects are funded by different other people, like foreign countries, people from different states like Bill Gates, Melinda. So they issued 3 billion, which is in upcoming. And we also have the tobacco-free campaign, which is currently going on. And also the Kavera campaign, which is also included in the sanitation. We have sanitation of schools. Most people from KCCA that handle the health sector program, they go to different schools, sensitize people about different sanitations, and also they go to different villages in Kampala looking for people who don't have toilets. They sensitize people and also issue funds, like give them money to build the latrines. They also carry out you have seen cars that pass around Kampala that collect rubbish like every weekend, or they get a day within the week. Those cars are provided by the KCCA. Then we also have funds that improve on the health sector, as in the health hospitals, whereby when the funds are given, they issue different money on different sectors like the hospitals, the clinics, and the sanitation programs, and there are many others. So in the hospitals, the funds that are given, they're supposed to buy drugs, although some corrupt people eat the money. They're supposed to buy the drugs and also provide beds and other facilities to the different hospitals. Thank you.
Good evening. Good afternoon. I'm Kaziba Dennis. As Kampala Group, we came up with a conclusion which says, as the Kampala Group, we approve KCC that has remained a determined leading directorate in providing accountable services. However, we recommend them to prioritize in getting a computerized health system in all cases health sectors, so as to do away with the challenge in adequate data entry that is usually done in a very informal way, thus easing the budgeting process for a better city. I want to end up by advising you that before you plan to spend your money, you first need to put up the first priorities, because we know that human needs are unlimited and resources are scarce.